ACL reconstruction involves pinching a small part of the body to recreate the ACL itself. Options include the hamstrings or kneecap tendons, and there are also other artificial ligaments and also donor tissue that can be used in certain circumstances. The surgery itself is keyhole surgery, it's day case surgery. There are a few risks involved, but obviously some significant rewards. About 90% of high-level athletes will go back to playing sport after an ACL reconstruction, but after a period of about 9 months of rehabilitation. The risks of surgery are quite small, but two of the main ones we worry about the most are infection and clots, and they can be minimised by the use of antibiotics and also some blood thinning agents. After your ACL has been reconstructed, attendance at physiotherapy is paramount in order to return back to pre-injury levels of sporting activity.